The CDC now says a more contagious and potentially more deadly strain of the virus, first discovered in the UK rather, is now the dominant variant here in the US. And while we know the pandemic has taken a terrible, terrible toll on people's physical health, new research shows how it's affecting people's mental well-being. A UK study looking mostly at American patients finds that 1 in 3 COVID survivors suffers neurological or mental disorders within 6 months of infection.
Wow, and among patients treated in the ICU, 7% suffered a stroke and nearly 2% were diagnosed with dementia. Researchers also found 17% of patients developed anxiety and 14% experienced mood disorders. One COVID survivor told Ian Lee about his life-altering experiences.
Discovered things, it's allowed me to see things that I otherwise wouldn't have seen.
Ivan Agerton has his dream job, traveling the world as an adventure photographer. There wasn't much that scared this former Marine, but that was before he caught COVID last fall.
And that really, really worried me because I have 3 small children and my wife, of course, and I didn't want them to get sick.
Weeks later, the 50-year-old from Seattle thought he recovered. That's when his world changed.
It instantly, like a light switch, I felt this intense paranoia hit me. I couldn't escape it. It kept every single person that I saw would trigger this intense fear.
What was more terrifying, he recognized the mental illness as it was happening.
My rational mind was still intact. I thought, this is absolutely crazy. What's happening? This isn't real. This can't be real.
Doctors eventually linked his condition to COVID. And he's not alone.
Essentially, a third of the patients in our 230,000 patients after COVID had 1 or more psychiatric or neurological diagnoses.
Dr. Paul Harrison's team at Oxford University found COVID patients were treated more often for a range of disorders, from common ones like anxiety and depression to rare conditions like dementia, and in Ivan's case, psychosis.
It was absolutely the most terrifying thing I've ever experienced in my life.
What would you say then is the turning point?
2 weeks ago, when I started feeling really good after I had my vaccination.
Ivan's back at work, but still worries.
How long is this going to stay with me?
He hopes by sharing his story, others will also find the courage to ask for help. For CBS This Morning, Ian Lee in London.
And psychiatrist Dr. Sue Varma joins us now. Sue, good morning. This was such a disturbing study when I initially read the story. What's the biggest impact COVID is having on mental health?
We're seeing that 13% of people who have never had psychiatric illnesses before, or neurological problems before, are getting this for the first time. And we're seeing anxiety being the most common, followed by depression, followed by insomnia, substance abuse, and in very rare cases, even psychosis.
Who's at risk?
The people that are most at risk are the ones who were the sickest, the hospitalized patients, the ones who were in the ICU. Those are the ones who are more at risk for the more serious conditions that we talked about, the strokes and the dementia, and the delirium, which is a waxing and waning of consciousness. But the scariest part are people who didn't even have either COVID symptoms or very mild COVID symptoms that resolved, or prior psychiatric known illnesses. They too are at risk for the anxiety and the depression. And it's hard to be able to tease apart, is it because of the hospitalization and just the fear and the economic impact and all the layers of the pandemic, or was there something also medical going on? And that's what this study picked up, that there was something medical going on in the brain.
Right. So, I mean, we're talking about people who have never experienced symptoms like this before in many cases.
Precisely. And that is so scary, especially when you're hearing voices, or the voices are telling you to harm yourself or harm other people, or that other people are out to get you.
So, these type of symptoms, are they ever linked to other kinds of viral infections?
They are, but, not to the manifestation, not to the extent that it is. When they compared in this study to COVID to the flu, or COVID to other control groups or other respiratory symptoms, you saw that COVID was twice as likely to produce these neuropsychiatric problems as compared to the flu. So this is something really unique. And the fact that people could have mild COVID symptoms, mild respiratory symptoms, and yet major mental health and major neuropsychiatric problems.
I noted that Ivan said in the story that he started feeling better after he got the vaccination. What should people do in this case?
Yeah, so the first thing is never underestimate or minimize your mental health concerns, because they very much may be linked to the inflammation that COVID caused in the body. You know, I think of COVID really as a multi-organ system illnesses. Many doctors understand this because of the blood vessels that are injured. We have inflammation, neurotoxins in the brain, and we need to be able to talk to both the primary care doctors, sometimes they're long-term care centers dedicated to COVID, and also speak to behavioral health specialists, and finally talk to your family about developing a care plan. A lot of people are having brain fog, memory problems. It's affecting their ability to function at home and function in the family. So really be able to have a comprehensive plan with the primary care doctor, your family, and a behavioral health specialist.
And as we saw for many people, these things are lingering. Dr. Sue Varma, thank you so much.